I am Dr. Asmatullah, and today we will discuss chapter number 22 of KANSKI. The name of this chapter is Trauma. So we will start with the eyelid trauma. A black eye are consisting of a hematoma, which is basically focal collection of blood, and or periocular ecchymosis. Diffuse bruising and edema is the most common blunt injury to the eyelid or forehead and is generally innocuous. It is, however, critical to exclude the following most serious conditions. Now let's see which are the conditions which are more serious. Number 1. Trauma to the globe or orbit. It is easier to examine the globe before the lids become edematous. Once swelling is established, gentle sustained pressure to open the lids will often displace tissue fluid sufficiently to allow visualization of the interior segment. It is critical not to apply any force on the globe itself until its integrity has been confirmed. Urgent imaging such as computed tomography, CT scan, and MRI or bedside ultrasonography, but taking meticulous care to avoid applying pressure on the globe, should be considered if there is suspicion of an underlying injury to the eyeball and adequate clinical visualization is not possible. That was the first one. The second is orbital roof fracture, especially if the black eye is associated with subconjunctival hemorrhage without a visible posterior limit, which would indicate the anterior extension of a posterior bleeding point. Okay, we will see the figures later. Basal skull fracture, which may give rise to characteristic bilateral ring hematoma. The tip of the KANSKI says bilateral periocular hematomas or panda eyes can be a sign of skull base fracture. Now look at the pictures. These are some pictures. Picture number A shows lower lid hematoma with subconjunctival hemorrhage. Picture B shows subconjunctival hemorrhage with no visible posterior limit. The posterior limit is not visible. C is panda eyes. These are some important points regarding trauma to the globe.